Well, welcome to the On Record podcast where we talk with professionals and other various subject matter experts from diverse markets. They're using video and audio in innovative ways to support their organization's objectives. My name is Andy Simmons, and my co-host is Mike Anzalone. How you doing, Mike?
Good.
And today our guest is Justin Fincher, who's a systems engineer from Children's Hospital of Alabama. Thanks for joining us, Justin.
Hey, good to be here.
Why don't we start simply? Just give us a couple-minute overview. Who's Justin Fincher?
Yeah, so my name is Justin Fincher. I am, like you said, a systems engineer here at Children's of Alabama in Birmingham, Alabama. I've been at Children's for almost 20 years. Started in January of 2006. And so at that time, actually, I started doing telehealth, using Polycom, using, that kind of stuff back in the day on a T1 line before it was all IP-based stuff. So that just kind of takes you way back. But I've been here for 20 years. I worked in our conference center that we had there. So we did a lot of telehealth stuff, a lot of video recording, a lot of video production, which ended up feeding over into the operating room using, integrated ORs, video platforms, video storage for surgical cases. So I did that for about 8 or 9 years and then shifted over to IT, where during COVID, as you probably are well aware, video really kind of took a huge leap forward, whether it was telehealth or the need to monitor patients from a distance. And so clinical observation recording really kind of took off. And so I've been at the forefront of that and dealing with that from, since COVID, especially when it comes to clinical-based recording from that need.
That sounds interesting, Justin. I'm kind of curious. You're talking about your experience in the OR. Can you expand on that? Was that capturing live surgical procedures, or was it a simulation-based scenario?
Yeah, so actually it was all live. And so we had a couple of different options. We could record and archive anything. It was all HIPAA-based, secure. It was, logged down to the specific surgeons that were doing the operations, but we could export that, and de-identify patients. But we could also view the ORs live. We had, through their integration, we had conference rooms that were integrated into the ORs. So we would have groups of people come in, whether it was donors, whether it was our board members doing rounding. We would bring them into the conference room and be able to pull up live surgeries and actually have our physicians talk to us from the OR and kind of guide some of these, whoever it is, community members, board members, through some of the surgeries that we were doing. And that just really it was a lot of PR. It was a lot of just keeping people that aren't necessarily in an operating room session, or they're not on the patient floors on a day-to-day basis, but they help run parts of decisions throughout the hospital to keep them connected to what we're actually doing in the hospital on a day-to-day basis.
Yeah, it's interesting. So I know you mentioned HIPAA compliance, which is certainly, a really big consideration, particularly in healthcare and when you're working with live patients. So how were you able to address some of the privacy and ethical considerations in using video in that kind of environment?
Well, in that kind of environment, it was a little different. The board members and people that were coming into these pieces, they're essentially a form of an employee for the hospital. And so with that, plus with consents that parents sign when they're coming in for surgery, that really kind of covered all of those bases that we were need. We weren't recording those sessions; those were just strictly live viewing. In the past, these board members would scrub up and walk into an OR.
Wow.
But then you've got infection risk. You've got risk where we've had people pass out, years ago in the middle of an OR. And so to reduce some of that, it's probably been 15 years now that we stopped doing a lot of the people walking into the OR, people, having to scrub up and do that, and then just showing it in live view now.
So how you started using video in the OR, and prior to that, how have you been able to expand the use of video throughout the hospital, and what kind of use cases are you using video for?
Yeah, so it's really grown a lot, especially since 2006, as you well know. It, we were running a T1 line with very expensive Polycom hardware, or Tandberg hardware, back in the day. Um, and of course, that's shifted so much because now you have so much more accessibility into that kind of stuff. And so it's grown from a behavioral health psychiatrist meeting with kids in 3 or 4 hours away in lower Alabama, being able to you know do that in a very small capacity because we had very few people. This is prior to even physicians being able to be reimbursed financially for this. And so it was a very small group of people that wanted to basically almost give their time away to meet with kids that, are 4 hours away. But, since COVID really, well, let me back up just a little bit. You really had to have a stakeholder when it come to having some sort of telehealth or video recording that was medically needed or that had served a medical purpose. And those were few and far between, honestly. You had people that were just blazing the trail, and those were the people that you'd have to get behind as a technical person like me to be able to push something. I would love to have pushed telehealth back in 2006, 2008, in that time frame. But I'm just the technical guy to provide the solution, not the guy to blaze the trail. And so you really had to have these physicians that were driving that. And so what ended up happening is some of these people began to, either fade out, they would move away, and then you'd have, a project kind of die off. But when COVID happened, and I bring that up just because that really kind of helped shove the, if it's telehealth or video recording or video observation, for me and for our facility, that really kind of helped shove that forward. Um, Super accessible. We're an Apple iPad based house. So I'm also the MDM admin for all of our Apple devices here at Children's. And so iPads in 2020 became a hot item when it come to using, a third party video conferencing tool. And then clinical observation recording and needing that became an extreme need because we'd had patients with COVID, and you'd have behavioral health patients on lockdown and trying to reduce the amount of infection and trying to reduce the times that a nurse had to enter a room, and being able to monitor those patients from a workstation just outside the room. There was a lot of benefit to that, and that's what helped drive a lot of the need. And then two, it continues to drive forward with even IVS and VALT being able to um, give us a camera on an iPad and using that as a streaming platform, being able to use that as a recording device. We're doing that now through our SIM Center. Our SIM Center, it really helped push a lot of that clinical observation. They're actually the first ones that had VALT here at Children's. And when I was the original person that developed their recording system. We used an iMac with a video switcher and cameras mounted on the wall, and they would video switch from room to room using this manual switcher. And then, of course, when VALT came along and I found out that they had kind of gotten that put together, that just really, it answered a need that I had from an IT professional for so many other people. And, we'll probably dive into that, but we're using VALT and clinical observation recording is what I refer to it here, on a lot of different platforms in a lot of different ways.
In the Sim Center, who are the major learners? Is it generally used for professional development? Are you affiliated with a medical school? How are the scenarios created for those particular groups of learners?
I don't know all of those details, but I will tell you that a lot of the people that are running, it's a collaboration, I think, between Children's and UAB, which is just next door to us here. A lot of the UAB pediatrics docs are our doctors that are here at Children's as well. And so it's a collaboration between those. And so you've got physicians, you've got nurses, you've got a wide range of people, operating room techs and nurses that are doing stuff like that. Um, I know we have done death and dying or death and coping simulations as well, where we have actors that are brought in and work with our social workers or our pastoral care staff, and in the case of a patient passing away and having to know how to handle those parents and how to help them in the middle of a time like that, which we see unfortunately. So it's such a broad used area, and honestly, they really helped drive a lot of that clinical observation recording, which just ended up spilling over into so many different areas, whether it's our imaging department, whether it is our Sparks Clinic in collaboration over at UAB, uh, screening kids for autism, to just monitoring behavioral health patients. In our we have an emergency room area that is strictly for behavioral health needs, and so all of those have 2 cameras in it and monitoring stations that it's basically virtual sitting with these
Mhm.
patients who are high risk.
You had mentioned early on when you were just using it in the OR that it was just live
Mhm.
observation, and then we jumped a few years to like where we're at
Yeah.
now, where you're talking about recording all over the place. Like, when did that transition kind of happen? Where it's like, you know what, we might want to actually use this footage that we're watching.
So we opened our newest facility, our main hospital, in 2012. So we did a major construction, and when we did that, integration happened at that moment. That's when I moved in 2012 from our conference center doing telehealth on a day-to-day basis and video editing and all that kind of fun stuff to the OR, because I had already built a relationship with the OR and worked with the integration for years prior to that. When we moved into that building, we planned for live observation and planned for recording at that time. It was about a year later after we opened the door, so it was probably around 2013 where the technology for recording was finally implemented and released, and we worked with the other company to get that taken care of. When we did that, what really happened and that was so beneficial, and I know for one group and one specialty for our neuro group, they were building a training catalog for surgeons. And so they were recording these items through the system, um, downloading them, putting together edits for talks, for training material for other surgeons, and for training those, and maybe even going overseas and training people in third world countries, being able to share that information. So that's really where a lot of the recording happened, especially from the surgical standpoint. And that's what that kind of benefited the most. And I think one of the things is being able to, I know some of our surgeons would review some of their footage before a patient would come in for a second surgery to review what was done prior, not only just reading a note and reading something in the EMR where, okay, this is describing what we did. They could actually go back and refer to
Actually seeing
footage
it.
that they had taken. Yeah. And so there was a lot of benefit there.
You had also mentioned like, a lot of spillover, and you named a bunch of different areas that are now using
Oh,
this.
yeah.
If you were to just kind of guess in the next couple of years, like, where else might this spill over to? Like, who's not recording that you think, like, yeah, I think there's probably a use case there.
Well, I think I can foresee in the near future us having some sort of, maybe it's not recording, maybe that's more live, but I'm thinking we could end up having cameras and microphones in every patient room for communication with nursing and helping with that kind of stuff. Now, when it comes to recording, I'm not 100% sure. I think we'll see it grow in more areas like autism screening for other pieces like that. I think that's where we're going to see a lot of growth. This Sparks Clinic that we just deployed 2 cameras in. It's one room, 2 cameras. They're really kind of blazing that trail from their standpoint, and I think we'll see that grow. I think they're going to see a lot of benefit from that, being able to review footage and chain of command, physicians being able to be involved. Um, I think we'll see growth there. I think we'll see multiple rooms outfitted with cameras where they see patients, and that becoming a normal thing for them. Um, but just off the cuff of my head, I
Yeah.
don't have anything really going right now.
Justin, as you've used video and you've expanded the use of video across the hospital system, what have been like the biggest challenges and obstacles that you've had to overcome?
I think certain employees and certain physicians or nurses, people just being comfortable with it and not feeling like it's this almost taboo thing. Like, why are we recording things? Like,
Right.
I mean, I think you see a lot of that. Um, there's also a technical limitation. What can we do? What kind of strain on our network is this going to put? So you have a lot of these different worries and concerns coming from different angles. But as technology has gotten better, network technology, video technology, it's really become a standard, especially with behavioral health. I mean, we already had so many cameras in our behavioral health units as a whole. But being able to deploy cameras into the rooms where we're able to help monitor patients and keep patients safe with
Mhm.
limited number of staff. I mean, as you know, if you just do a quick Google search, you'll see that behavioral health is just, and mental health is such a huge growing space, which is terrible. I hate that. But that also puts us in a place where we have to make sure that we've got the technologies in place to help keep those patients safe when they're in our care.
I know there's a nationwide nurses shortage, and I'm curious from your perspective, particularly with patient monitoring, is that
Mhm.
a potential solution to offset nursing shortages?
Oh, I've had this exact conversation. I think absolutely. I think you have nurses who are probably ready to retire, nurses that are considering the strain. Maybe they're having kids, and maybe they're wanting to reduce the amount of hours that they're working. I think that opens up such a huge opportunity for especially, like, onboarding patients, maybe, admitting patients and having to do that admission consult with a patient, or maybe it's a discharge consult. Right now, a nurse on the floor who maybe is taking care of a sick patient, they're backed up and maybe they've got 3 patients that are ready to be discharged. It's not uncommon for us to get a text on any given day going, "Hey, we've got a high census alert. You know, we we've got a lot of patients in the hospital. We're almost full. At what point do we start discharging?" And so at one point when we started hearing the phrase virtual nursing, I was at a JANF user conference a couple of years, and some, colleagues from California, Cincinnati Children's, we were all just having conversations around virtual nursing. And so we began to go, "Hey, what benefits does this bring?" I mean, you can have these nurses that want to retire, but what if you could keep them on and give them a job where they could video conference with patients in the room and go over discharge instructions, freeing up a nurse that's on the floor, being able to, care for another patient who's sick or needs them more than just coming into the room and discharging them and having to take that time away from the nurse that's busy running around on the floor. But what if that nurse could virtually discharge a patient? And, I just think there's a lot of really cool options there. And I'm looking forward to seeing where that goes down the road.
I know you're a tech guy, right?
Mhm.
And you're putting these systems together in the hospital environment. What engagement level, if that's the right word, have you had with like the risk management team and the patient safety team in terms of, again, I know one of the goals is to reduce readmission through patient safety and other measures. And some experience I've had is, using video for things like latent threat analysis or root cause analysis, things of that sort, when an incident or a near miss type of thing has occurred within the environment. How have you engaged those individuals, not just from a tech perspective, but from an overall operational perspective?
Yeah. Uh, I haven't had to engage them very often, but I do know that a lot of our risk managers and some of our, um, I forget, I can't think of what they're called. But, anyways, we'll just call them risk managers. I've had them come to me and go, "Hey, can you fill me in on what this is?" Whatever that project may be. If it's, especially with video, whenever you hear video or recording or audio, red flags go off with these risk managers. Um, But honestly, when I've had these conversations with them, when you really look down to the security that we're adding, when you break down the security, when you break down what we're doing with it, how it's segmented, how we're keeping it safe, how we've created these containers for these different groups where content from one group isn't spilling over into the other, they walk away and go, "Oh, okay, that's awesome." I mean, so I think it's the unknown is when you start getting a lot of
Mhm.
the concern. Um, I do see concern when it comes to probably operating room type stuff. When we've done recordings in the past, we would go over policies and procedures. There's a lot of concern of, from a risk standpoint, especially from a legal standpoint.
Mhm.
There can be some concern with, well, what if we're recording this and something goes wrong? I mean, but that's always going to be the case. I think any hospital in the nation is going to worry about that and make that a concern and weigh that for sure. But I think the benefit definitely outweighs all of that.
So let me ask you this question, Justin. If our listeners are working in the healthcare system, thinking about putting in video, what kind of advice, guidance, lessons learned can you offer them?
I think get buy-in from, for us, we've got our server team, we've got our network team. We have a lot of different teams within IT. I'm a little on the special side, and there will probably be people that would say that I'm a special person as well that I work with on a day-to-day basis. Uh, but but I handle a lot of special projects and a lot of things that aren't typical IT things. I mean, right now I'm looking at deploying Nintendo Switch consoles in our behavioral health area for these kids to have stuff, and I work with Oculus and virtual headsets, and I push out Apple TVs and different streaming services for our child life group. And so I get to work on a lot of fun stuff. So I'm super grateful because I get to do a lot of fun things. But no matter what project you've got going on, whether it is deploying video or recording capabilities, I think having people in all of those areas, whether it's network, server team, being on the same page. And I think finding those people that want to have a stake in that project. Because look, I mean, we all have people that it's a job every day, and you get frustrated when you've got to do something you don't want to do. But for me, I look at my job as I love what I do and I love coming in here every day. And if I can do something that's going to benefit a patient, if I can do something that's going to help a nurse or a physician with their job day to day and make it better, or provide this cool feature that they never thought they'd be able to have. If I can do that, then that's just I like to innovate, and that's a joy to me. But just finding those people that can be a stakeholder with you and help build out a project the right way. And then just planning. It's never easy to just throw something together. And I think it's just plan it out right and just find the people that are going to help continue to push forward that project.
Justin, we had someone in a similar role to yours, but at a university that we spoke with a few weeks back. And this might be bringing the conversation back a couple minutes, but you just mentioned a bunch of like really
Yeah.
cool projects you're working on.
No, you do.
We had a deep discussion with this gentleman about balancing like being an early adopter with a lagger with technology and making sure something's not a fad when you implement it.
Mhm.
So you're talking about using some products. I mean, Nintendo Switch is not new, but using it in your capacity might be. So how do you kind of weigh that with the team that you're working with to say like, okay, we're going to spend a lot of money on this, but we know it is worthwhile for these reasons?
Yeah, it's definitely purchasing test equipment and research, getting demo equipment in here. Being an Apple MDM guy and working on different projects. We're an Epic EMR house, so we've got a lot of new projects going on. We went live with Epic EMR in March of 2023, and we have not stopped. And we're continually rolling out new pieces along the way, whether it's hardware. For us, the Nintendo Switch 2 is the new one. So one of the big things that let me just I'll talk with that project, for instance. That's probably the newest one on my brain right now. We've got a need, and that need came from our behavioral health group to have. I think they're using Nintendo Wii's right now. Of course, those are dated, and so they brought the need to want to do Nintendo Switch 2s in all of their common rooms. And how do we lock it down? How do we keep it safe? How do we make sure kids aren't able to get on the internet? How do we make sure they don't mess up these units? And I went, we have to get one in. First off and foremost, we've got to get one in before we ever move forward with the project, and we've got to do all of our due diligence here in IT. How can we manage? How can we purchase games? Can we, purchase one unit and download all the games there and make it like a master unit to where the others are like, child units, and, what can we do? So it's just a lot of testing, and with Nintendo Switch 2s, it'll be a lot of playing. To make sure that we're doing the right thing. No, but it's from an IT standpoint, when we're managing thousands and thousands of devices here, we always ask the question, can we manage it with something? Whether that's an MDM or is there a management console for something to help us keep these things updated, keep whatever it may be. So that's always kind of our first look when we start talking about devices and hardware is how can we manage it? Sometimes there's not a really clear answer for that. And so sometimes we deploy them one way and then a management solution comes out later, and then we have to kind of backtrack and go, okay, now how can we get all of these units managed into this system? Oculus headsets. That's exactly what, when we first deployed them, we had to deploy them all with their own accounts. Now I think there's some management capabilities on the back end. So now I have to eventually get to the point where we go back and we retrofit those back into that management system instead of just managing them individually.
Well, Justin, I think this has been a very informative conversation. I think our listeners will walk away with a lot of great information. How can our listeners get in touch with you if they have questions?
Yeah, so I am. They can reach me at justin.fincher@childrensal.org.
Well, thanks again. We really appreciate your time.
Yeah, absolutely. Thank you.
On Record is a podcast presented by Intelligent Video Solutions, hosted by Mike Anzalone and Andy Simmons, and produced by Kyle Shellstad. Find us online at ipivs.com/onrecord and on social media at Intelligent Video Solutions.